This is Body, Brain, and Pain. I'm Erin Babineau.
And I'm Michelle Steggy.
We are two doctors of physical therapy and orthopedic specialists, here to have an approachable and courageous conversation about pain and our bodies that will be forever changing and aging. We have these vulnerable discussions with our friends, family, patients, and community, and we want you to be part of this conversation. Every person's body is different and may require a slightly different approach to managing pain. The better you understand how pain works, the more control you gain.
Through each episode, we will teach you how to be curious about your body and empower each of you to be the best advocate for your own health and well-being. It's not sexy, but given the right tools and information, we can start to see how strong and amazing our bodies are, on their own and often without expensive interventions.
Also, what's not sexy about your body and brain being the only tools you need to help you feel your best? At times, it may even feel like we're anti-healthcare, but we're just no BS PTs trying to help you navigate the world of healthcare.
Let's rewind and get back to the basics here. We will explain along the way how we got so confused for so long, how it's come to be that we are the nation with the highest healthcare costs, yet ranked so poorly in the world for quality of care, and have ultimately lost a lot of trust in our system.
Come join us on this journey. It's not always what you may want to hear, since we will be talking about tough and uncomfortable things like aging in our bodies, trauma, inequality with access to care, and mental health, but we promise we will provide you hope and maybe some laughs along the way.
Welcome to Body, Brain, and Pain. Erin and I are super excited to have you guys listening to our podcast. And so first of all, just to review kind of why we're doing this podcast and what led us to this point. So we want to give you guys a glimpse into our treatment rooms. And especially lately with this pandemic, Erin and I have had tons of conversations about patient cases and the things that we're seeing. And we started to realize that we were feeling like broken records, essentially, because we were having these same conversations with patients over and over again about pain. And especially during the pandemic, it seems like a lot of people are experiencing more pain, and it's not always easily explained. And so this podcast felt like a really awesome way for us to get this information out to a lot of people for free over a medium that can be shared with tons of people. And so we're super excited to have you guys here for that.
Yeah, awesome. Plus, then you don't have to keep listening to us at your picnics.
Exactly.
Right?
Yes. Yes. Because we're having these conversations outside of the clinic. People are asking us questions in passing about like, oh, so I've got this thing going on with my knee. Like, what do you think that is?
And that's a joke for all PTs, right?
Totally. So let's start. Erin, I want you to talk about like the biggest misconceptions that you have right away that you see patients having pertaining to pain.
Yeah, I love that. I mean, I think not just patients, kind of like we're joking, but our whole community right now and world, honestly. But the largest misconception I find is people come into my office and our clinic and they don't even know what pain is. So some people have searched for years trying to, solve this particular type of pain they're having, and they don't even know kind of what even pain is, or the answer is kind of all over the place. They've sought multiple opinions and they've been told that their cause of their pain is due to 4 different things. So when I ask them, like, do you know what pain is? Usually I'm getting kind of a crazy look of confusion of what is this lady talking about? Which is kind of crazy because, most of the time in healthcare in the musculoskeletal world, which is our world, that's what they're coming in for. So they've not once been told, like, this is the science of pain, or in our world, we call it pain neuroscience. So I don't know, Michelle, that's our lunchtime conversations every day.
Every day.
So Michelle, like what do you tell people when those first few conversations, and a lot of this we're talking about persistent pain or
Yep.
pain lasting for more than, 2, 3 months. But what do you tell a patient when they're kind of looking at you with confusion, or that neighbor or family member who's looking at you with confusion? What is pain? Can you define pain and that science of pain? We call it pain neuroscience.
Yes. So, I think one of the biggest things, and probably one of the things that I think can be the most empowering for people, and one way that I like to describe it most frequently, and remind people, is that pain does not mean something is damaged. It's pain is an alert from our brain to our body for protection, which obviously is a good thing. Now, that is very much oversimplifying pain, but I think it helps people feel a little bit more at ease if they're knowing that, okay, even if I'm having pain, it doesn't necessarily mean that something is damaged. And so, one definition of pain that I think is easily understood comes from Adriaan Louw and colleagues. And the quote is that pain is the nervous system's interpretation of the threat of the injury rather than an accurate measure of the degree of injury in their tissues. And so pain doesn't necessarily mean that if there's more pain, that equals more injury, but it's more of just your body's interpretation is more intense. And
Right.
I love, and I use this all the time, I use the alarm system analogy. So, like someone's house alarm. And I think people really understand that. And I think it makes sense, especially when we're talking about the persistent pain where maybe that pain response doesn't necessarily match what we would expect it to. And so if you think about a house alarm, if that alarm is set to go off for someone to break a window, that's super helpful. That gives us good information. It keeps us safe. But if that for some reason that alarm has become too sensitive and it goes off when like a leaf hits the window, that's a huge problem, because then you're constantly reacting to this alarm going off, but there's actually no damage occurring.
Or threat, right? And it's
Yes.
back
Yep.
to, I think the biggest misconception, and Adriaan Louw is a very well known researcher who does amazing work and has kind of given us a lot of these analogies, but that, pain is truly an output message from our brain,
Yep.
like you said, for that protection. And we often think it's this kind of input, like you hurt your foot, and so that's damaged. So,
Right.
and I think clearing this up in a lot of people's brains right away has been extremely helpful.
Yeah.
And
And
it's
we
pretty,
know and we know that that information is helpful and can actually change the output message or your pain response to an activity or a situation. And there's tons of research to support this, that just learning about pain and understanding pain better can change your response.
absolutely. I think we'll talk a ton about that in our next episode, which will be fun. So
Absolutely.
I always say, like I had a patient tell me, that pain is a way of your body telling you that how you're doing something just isn't working anymore. And
Yeah,
I really liked that, because
absolutely.
we talk a ton about that, of just like using pain to be curious about your body and learn and make changes, because 99% of painful situations truly are non-emergent, right? And we are trained to know if you're not fit to be in our office. So we're really fighting to find out like what's causing this pain. We know pain is multifactorial, so relating full circle back to why we're having these conversations more and more. Being in a global pandemic, our stress is way higher, our sleep is maybe less consistent, our activity is way different, right? We're working out more, working out, or sitting way less. Our work setups are way different. We might be even laid off, right? There's a lot of things going on. So Michelle, how did we get confused for so long?
Yeah, so I think to help explain that, it is important for us to acknowledge what medical providers and health professionals are being taught, because that's where it starts, because they're the ones that are educating people every time someone is in their office. And so for a long time, we have followed, and so the medical system and a lot of health professionals have been taught using what's called the biomedical model, which it's something, but it doesn't look at the whole picture. And so it looks more at specific tissues causing pain, and it doesn't look at the whole picture in our whole body. And so there's a more holistic and realistic approach that is starting to become more well known, and it's been around for decades, and there's a lot of science to back it up, but like anything else, it takes a long time to get that into practice. And so it's called the biopsychosocial model. This model still looks at our biology. So it's still looking at the anatomy and the physiology and everything that's happening at specific tissues, but it's also considering psychological and social factors and how these contribute to an experience. And so this is our entire biology. It's looking at our body and our brain, which is very important when you're talking about pain.
Right. I mean, it's our entire being that contributes to pain. I always say,
Yep.
we don't just treat your back pain, we treat the human in front of us, because that is truly where the science is right now.
And that's
And
why
yeah,
pain has become so complex, and that's why people get really frustrated with it and feel so confused about it, is because it's so complex and everyone is having this individual experience. And so that means that there's not always these specific clear answers that they're getting, and that's frustrating for us as humans, and I totally get that. And I think we're all, that happens to all of us, where we get frustrated because we're not getting an answer that we want.
yeah, I often say our a lot of these persistent issues can be, mucky waters for a while, and
Oh
that's
yeah.
completely normal, and no one wants to hear it. But I say that bluntly to patients and family and friends of like, if your body's been flared up and had this alarm going off for years, it is going to be mucky, and that's totally normal from a physiological standpoint. So we take small steps to figure that out, and that's kind of what our podcast is going to be about, which is cool. We're going to dive into
Yes.
all these different steps and all these fun topics. So yeah, we look forward to this journey with you guys.
Thanks for listening.
Thanks for listening.